Getting an eyelid lift is one of the most common plastic surgery procedures as people age, but Dr. Justin Johnson with Utah Eye and Facial Plastic Surgery says there are some key things to consider when choosing a doctor. Let's talk about that research, because any patient goes into an appointment or a procedure knowing they should do their research. What kind of questions should you be asking for something like an eyelid lift?
Well, first of all, you want to ask the doctor if they've been specifically trained in that procedure. There's lots of doctors who do a lot of procedures and they do them well, but really you want a person who just focuses on that area and does a lot of procedures in that specific surgery.
So let me ask you, as the expert on eyelid surgery in Utah, what sets you apart then?
Well, first of all, I did a fellowship specifically in facial plastic surgery, centering on the eyelids and eyebrows and cheeks, that type of area. Secondly, I do a laser sutureless, bladeless eyelid lift. So I do not use sutures anymore. I don't use any knives because they cause bleeding. So this helps the patient heal quicker, recover quicker, get better results.
So in terms of research, it doesn't offend you when a patient or a potential client starts to ask you about your background and your training?
No, not at all. I'm happy to have them ask about my background because I'm proud of the training I had, so they can ask away.
When it comes to an eyelid lift, talk to me about some of the results that patients have seen from this procedure. You say it's life-saving in some situations.
Well, a lot of the times the eyelid skin or the eyebrow skin pushes so far down that you don't see well. So I had a patient recently who had an eyebrow and eyelid lift, and she came back to me. She said, on the way back, I was about to turn right, and there was a biker going right by me. And normally I would have just run right over the biker, but since I've had the eyelid lift, I could actually see in my periphery. So she felt like it had actually saved a life.
And we're looking at some pictures, and obviously the physical transformation is pretty dramatic, but you point out it's not just a cosmetic fix, as that woman experienced.
Right, so a lot of the time it's functional, and your insurance will actually cover an eyebrow and eyelid lift. So we do a fair amount of surgery where the insurance actually covers the procedure.
And I want to ask, I understand you're opening a new med spa. Tell us about that.
Yeah, so we're really excited. In a couple weeks, we're opening a new medical spa. We're adding a lot of different services. We're adding a lot of laser procedures. We're adding some massages and facials, and we're adding some great product lines that no one else is doing. So I'm doing some really great customer service initiatives, expanding, so we're really excited.
That is exciting. When can patients visit you at your new facility?
We'll be in there around the 20th of July. You know, it depends on how the build-out goes. Supposedly we're supposed to be done the 15th of July, but you know, I'm not really counting on that specifically.
You're taking that with a grain of salt.
Correct.
Probably wise to do. Well, congratulations on the new facility, and thanks for kind of sharing us some background about the procedure of eyelid lifts. If people want more information, where can they find you?
Yeah, they can call us at 281-3223, that's 281-FACE, or they can go to eyelidexpert.com. And also we have a special for our KSL listeners. The first 10 people, we're giving them half off on Juvederm.
Oh, wow.
So the first 10 people to call will get half off. It's normally $5.99. We're going to do it for $2.99.
And Juvederm, the plumping agent?
Correct. So you can do lips, wrinkles on your face, all sorts of areas. It's a great product.
Okay, thanks for stopping in.
Yeah,
Good to see
appreciate
you.
it. Thanks.
When we